Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Today we're going to talk about drop attacks. So, drop attacks can be very, very scary, even life-threatening. So we got a beautiful young lady here from California who I've known since December of 2024, Brenda. So why don't you just tell people, before you came here, you obviously saw a lot of people and you were starting to get worried about your condition. So tell us about when it started, the drop attacks and other symptoms you had, and then what made you end up, flying across the country to come to Florida to have me see you?
Definitely. I was diagnosed with Menieres disease about 18 years ago.
Okay.
So off and on, I've had vertigo. But a year ago, I started having a totally different sensation, and the doctors have called it, I saw an otolaryngologist, and he called it drop attacks.
Okay.
So yes, I have seen several people. I've seen ENTs, otolaryngologists, neurologists, regular doctors. I happened to run across one of your clips on YouTube, and you were describing all of the symptoms that can come from cervical instability. And when you got to the part about Menieres, it was like, it just really resonated with me. And I said, I think that's it. I think that's what's causing my Menieres and therefore the drop attacks.
What was your maybe top 5 or 6 symptoms that you had?
Feeling off balance, almost like I'm on a boat, just dizzy. When I'd have the drop attacks, I didn't have warning, but it would just all of a sudden, it felt like my brain was flipping, doing a somersault, and I would lose vision and just fall backwards.
Would you be out just for a moment, just for a very short period of time?
I never went out, never lost consciousness, but I'd have to lie there until I was able to get up.
Yeah, that's happened to me once in my life. So I actually, in a weird sort of way, almost all the symptoms that my patients have, I've had at some point. So yeah, it was actually in a hotel room. It was just totally scary. Then I'm on the ground and I'm it was really, really scary.
Well, it gives you empathy.
So did you have other symptoms? How with ligamentous cervical instability, people often could have head pressure or clicking or popping in their neck, or their stomach doesn't work, or swallowing or vision things. Did you have any of those symptoms?
I had definite clicking and popping and constant pain in my neck. Every time I go to the chiropractor, he'd have to realign my C1, C2. It was never in position. It was always off, and that was weekly. I was going weekly because of the pain. So can we fast forward? Today will be my 9th treatment. And since I've started, I've seen a definite improvement with the cervical stability. And I've gone to my chiropractor. I went just 3 days ago, and he said, you're solid. It's staying put. So I didn't need a realignment. It's worked that way.
How's the dizziness and the drop attacks?
I still have some dizziness, but I think that's from other issues like sinuses. There are so many reasons that can cause dizziness, as you know. But the drop attacks, I haven't had one since, 10 weeks now.
Okay, so that's
so
great.
Definitely they're getting,
You're doing good.
I am.
When you go to an ENT doctor, and you have Menieres or you have benign positional vertigo, some people also can call these things vertiginous migraines. There's a lot of different nomenclature, and when by the time people come there, I think a lot of it relates to the jugular veins being compressed. And then, with Menieres and stuff, you can sometimes get ear fullness. Right now, I have a little bit of right ear fullness versus left ear fullness. I got a pretty big styloid on my right side. So occasionally what happens is, I know how I'm supposed to sleep a certain way, but during the night, sometimes I'll flex my, not knowing it just happens in the middle of the night. So then my jugular vein gets blocked all night, then I'll end up with, the ear fullness. Did you ever have the ear fullness, or did you ever have symptoms more on one side than the other?
Yes.
Okay.
Most definitely.
Which side?
My left side. I
Okay.
have constant tinnitus
Okay.
and profound deafness in my left ear and fullness. And I
Okay.
think those are the classic symptoms for Menieres.
Yeah, exactly. So I guess people who might be watching this, just not for drop attacks, but they have Menieres, what I find when people have those symptoms, just like I'm telling you, like right now I have a little bit of ear fullness, it almost always is the jugular vein is blocked on that side. So my question, I guess, is normally the ENT doctors would order a CT scan of the temporal bone. Do you remember, did they ever, like to look for, it's called endolymph hydrops, or another name of it is called semicircular canal dehiscence.
Yes.
Did they look for that?
Yes.
And was it okay, or you actually had it?
No, I have it. And
Oh, you do?
Yeah.
Did they have, was it mostly on the left side?
Yes.
Okay.
Yes.
Here's what I would just suggest, because I always feel like for you and me, it'd be nice to know that resolved or it didn't resolve.
Right.
Yes, I think we should probably order that, so maybe in 3 months or something,
Okay.
just to see if the semicircular canal dehiscence. And for anybody who's not familiar with that, I did make a whole video. I don't know if that's one of the videos you watched, but basically the things that control balance is the semicircular
Right.
canals. So what happens is, this is just Dr. Hauser's feeling about the disease, or my feeling about the disease, is if you get a blocked jugular vein, then the pressure, all the fluid that's trying to go here is the pressure is gonna go up because there's a block here because of the jugular veins getting blocked. So then the pressure in the fluid pressure in the semicircular canals, the endolymph can go way up, then the bone erodes. So the bone erosion in the temporal bone is called semicircular canal dehiscence. So it'd be interesting if a person did cervical curve correction, got stability, and the pressure went way down. Does the bone, did your bone actually repair itself? And then you had some kind of vision thing too, right?
Just recently.
Okay, so talk about that.
Okay. Recently, I experienced, it's like kaleidoscope vision, where the inside is kind of blurry but clearer than the outside, and it's a circular pattern of little colored triangles. Strange, not knowing what it is the first time, but I have researched and talked with my ophthalmologist, and it's related to migraines.
Yeah.
So that's a new experience for me.
Was it both eyes or one eye?
It was both eyes, actually.
Okay, yeah. Back in the day, they would call it migraine equivalence. It's interesting. And it can be the same pathophysiology. It can be the same. Today's number 9. Usually I don't test your optic nerve sheaths until visit number 10. But yeah, anyway, we'll just keep a track of that, because that, still can be the jugular vein. Now, before you came, you had a hearing test, before December 2024. And did they say, like, you lost so much hearing in your left ear?
It was profoundly hearing impaired.
Did you need a hearing aid?
Ear. Not yet. I'm waiting to get all this stabilized, and then I'm going to get hearing aid.
Okay. You don't know if your hearing changed at all since I've been treating you?
I can't tell yet.
Okay.
Yeah,
Okay.
it's a little
Okay.
soon.
I just wanted to talk maybe just a little bit about one of the potential causes of hearing loss. Okay, so let's just say every day, Dr. Hauser, let's just say I didn't know that I had a jugular vein being blocked here. And I just always slept on my right side and I was all hunched over. So all night long, my jugular vein on the right side's getting blocked. Well, basically what happens is the pressure in the cerebral spinal fluid goes way up. And the cerebral spinal fluid, it surrounds your eye nerve, it surrounds your hearing nerve. So it's in a sheath. So you have the nerve, then you have the fluid, because you got to realize there needs to be cushion, right? Like, your head gets bumped around, you know, every time you move, there's a little bit of movement. So the way God made it is there's this fluid cushion around it. Plus it has some other effects, nutritional effects and different things. So you have a sheath, you have some fluid, then you have the actual. So if the fluid pressure goes way up because the fluid can't get out normally, right? So now all of a sudden that cable, the eye nerve cable, the hearing cable, the cable takes it to the brain. Like you actually don't see until the image goes to the brain, and you don't hear till the sound electrical transmission goes to the brain. So you can understand where if the pressure goes really high, eventually my hearing nerve, if the pressure doesn't go out right, I'll be in the same boat. Like I'll start permanently losing hearing. So that's where people who are losing vision, losing hearing, you know, you really should get checked out to see if there's jugular veins getting blocked, because unblocking it potentially could at least stop the process. Like, you know, so let's agree. Hopefully, we're hopeful this is the last visit, and then what we normally do is I would give you a form to get an X-ray back home in California, like in a few months. One of my staff takes a full history. You know, then they just communicate it to me. Then I'll order the CT of the temporal bone just to see if the semicircular canal dehiscence is better. And then probably, you know, in a few months, you know, get a hearing test and then try to make sure that they compare it to the old one so you and I know it's the same, it's worse, it's better, and it'd be interesting.
Okay.
It's interesting. I have one person who basically was blind in one eye. You know, I can't say that, you know, somebody's blind in one eye and then we can repair it, but it was interesting. Because again, on that side, they had the jugular veins were severely blocked, and now the person can see light images. You know, so that was like, that's kind of an interesting case that I'm seeing. He's really interesting.
Well, it's cool to see that you make progress, right? That's working. And I feel good. I feel like it's working. I feel like it's certainly done what it was supposed to do, you know, which was stabilize my C1.
And then
C2.
you have to.
And then you have all the benefits.
You have to do your neck stuff, and you have to be responsible with your posture.
Right.
That's all I want people to do, is just think about looking up instead of looking down, you know. And it's like horrible, right? You go to any restaurant, you go in the waiting room, you go to Starbucks, you go to wherever you go, man, everybody's looking down.
Yep.
I would just encourage people that we need to get back to talking to each other. You know, like it used to be, you know, you go to Starbucks or you sit on an airplane, you go to anywhere, you're in line at at groceries, you know, people would talk to each other. You know, we have to, and I'm sure you appreciate that when you got here, right? Because, you know, because I always try to
always
just try to talk to
you. Always talk. You always make us feel very comfortable, and and you're like that with all your patients.
Well, no, I appreciate you coming on, and we'll do hopefully your last visit, but thank you so much for being a client here.
Thank you, Dr. Hauser. It's been a wonderful experience, and I have to say, your staff is amazing. Every one of them have made me feel very, very comfortable. And you make me feel comfortable because you come in and you're just like Mr. Sunshine.
Thanks, Brenda. Appreciate it.